starting this wasn't to get rid of my headaches because I always thought that they were going to kind of be there forever, or they were kind of like the long haul part of being Emily is you're going to have a headache. So that was definitely just like a very incredible added plus to this whole situation that I didn't think was going to happen. So I can't really say anything but great things about how that one played out.
Hey everyone, it's Dr. Ruscio. Welcome back. And today I'm excited to share with you a case study or a patient conversation from our office between Dr. Scott and his patient Emily. And there's a few really insightful, or at least I hope they will be insightful findings as they pertain to female hormones and how the gut is actually a very powerful lever through which we can exert a female hormone balancing effect, or at least we can resolve the symptoms that are oftentimes attributed to female hormone imbalances. So what we'll do here is I'll play a clip from their conversation, add some of my comments, and kind of weave back and forth. So now we'll go to the conversation between Dr. Scott, his patient Emily, and how she was able to improve things like headaches, acne, low energy, low mood, and these kind of female hormone-associated symptoms via predominantly gut care. Okay, so let's head over here and jump in.
Hey everyone, this is Dr. Scott here, and I'm here with the awesome Emily, and I just want to share her story because she has a really fantastic story, and kind of want to thank you for being here. So thank you, Emily.
Thank you.
Absolutely. So can you just share with the audience sort of what your symptoms were when you came in to see me?
Yeah, I felt very generally overall just very off. My hormones were definitely all over the place. I would bloat anytime I ate. My skin was just full of acne. My hair was thinning and just lack of energy and just big mood swings. And I definitely knew that that's not what my body should be doing. I definitely knew like that wasn't as good as it could get.
Right. And what was the most, I guess, troublesome symptoms for you, and how were they impacting, your daily life?
Yeah. So, hormones are different for everybody, but how it affected me to where every month I kind of felt like I had the flu, and to where the lack of motivation and trying to just to get on with life when you are kind of feeling that way is hard. And then also just the lack of confidence you get when you don't feel like you are in your true best self or your best fashion. Those were the major ones. It's just the overall, how I felt about myself definitely wasn't what it should be. And then how I felt or what my body was doing was kind of causing that too. But right. I think most of it was my internal feelings for myself. And then in return, knowing what I wanted for myself, I knew that I had to fix those things.
Yeah, absolutely. Yeah, the way you feel about yourself is so important, and our health definitely affects that. And I know some of your main symptoms, like the bloating, you've had migraines for years, since 2003 is what I have in my notes, the acne, the heavy periods, the fatigue, all of that. And so my initial thoughts there, and also diagnosis of PCOS. And just one of the things that stood out to me was just the gut health symptoms, that just significant bloating. You felt like you were always bloated. Whenever you ate something, you just felt like you quote unquote blew up in the stomach. And that to me really signified just imbalances in the gut bacteria. And I remember even sending you like a message just about, how the gut can affect PCOS. And there's been a correlation there. And so as opposed to just going right into treating your hormones, we really focus on the gut. And what was your, what experience did you have previously with working with other people in terms of treating that? Like, what was that experience like for you?
Okay, so a few key points here. If you look at these symptoms side by side, clearly there's a skewing toward female hormone symptoms. Fatigue may not only associate, of course, to female hormone imbalances, but we'll put that there just for argument's sake. Acne, thinning hair, mood swings, heavy periods, and migraines certainly fit within the female hormone bucket. And then bloating. And I think Scott is really on the right path here with asking the question where to start. There's mostly hormonal symptoms, but she had, as she'll mention here a moment ago, tried hormonal supplements before. And this is a all too common finding for us at the clinic, wherein providers want to treat the cortisol, the thyroid levels, or the female hormones before making sure they really have in place the diet, lifestyle, and gut health foundations that we find to be very pivotal for individuals. And absolutely, there are times and cases where direct thyroid hormone treatment or female hormone treatment is needed, but it's crucially important in so many cases to make sure you don't skip past that foundational step of diet, lifestyle, and gut health. So let's go back to their conversation and see where they go from here.
Yeah. So like you said about the headaches, I even forget to mention it because I had to have them all my life, that you don't really realize that they're not supposed to be there. But initially for the treatment, I've tried different things with hormones. I've tried medications. I've gone to a whole bunch of other doctors, and I knew that a whole bunch of supplements and a whole bunch of extra things are not what I work best with. I'm not a very great scheduled person. I'm a little more sporadic. So I like the idea of approaching it and just kind of focusing on one part of my body and not trying to fix all the symptoms at once, and just trying to focus on one core area that we can really like hone in on.
Yeah. And that was the kind of the initial plan here. It was really, we just focused on nutrition. We put you on a low FODMAP diet to really help calm down the inflammation and the dysbiosis in the gut. And I was reading through my notes, and it was framed in a way that was like, it's just going to be a month trial. Like, let's just see how this goes, as opposed to saying, this is the diet you must stick with. This is kind of a forever thing. It wasn't as rigid. It was more, let's just see how it goes for a month. And then after that, we'll talk. So we did that. We did triple therapy probiotics and inositol and spearmint tea. So the inositol and the spearmint tea were more for helping to lower testosterone, which you had said had been high for a long time in the past, and it was high on the initial labs that we did. So after we met next, so you've been on the diet, probiotics, inositol, and spearmint tea, and then and I have my notes here, so I know it's easy to forget. But do you recall how things were after that first visit?
And so just a quick aside here, this is not a very complicated care plan. A low FODMAP diet, and I think it's really important that Scott clarified this was a trial. Patients can sometimes think that the diet being recommended day one is a forever diet, and that's usually not the case, unless someone is eating a very high processed food, low quality diet. And then, this may be a forever shift, getting away from soda and highly processed food. But there's always going to be, at least I think in our opinion in the clinic, flexibility to make it workable for the individual. Triple therapy probiotic, and then inositol and spearmint tea. This is definitely, at least seemingly so, a contrast to the heavy-handed supplement care she had been given prior. And this is one of the things that I think we're doing a really good job of at the office, if I do say so myself, is limiting the amount of therapy we use out of the gate. And we actually find that less is more. But let's see how this went for Emily.
Yeah, so definitely. So when we first started doing the food, I think it was easier to kind of stick with that plan because it wasn't adding anything new. It was just using what I already had, because we have to eat. So if I just treated it as new ingredients, so I had to use the probiotics, I just treated them like a new ingredient. I didn't think about it as a supplement. It was just something to add to what I'm already eating. And then even just that first, I would say within the first 3 to 4 weeks, I felt incredibly clearer, if that makes sense. Like it was almost like a fog was lifted. And also just generally, I felt like I could breathe easier. I wasn't so bloated about things. It was just, my body felt a little more at ease with everything.
Awesome. Yeah. And I also have here that you lost about 15 pounds, which we weren't, there's no calorie counting or anything. It was just, focusing on clean, real food. And everything basically improved except for the heavy periods. That was the one thing that didn't budge. And so, like I had said at the initial visit, we're not going to tackle everything at once. Let's just see what happens with this initial plan here, the probiotics, the diet, and then the inositol and the spearmint. Heavy periods didn't clear up. So we ended up adding in a herb.
Okay, so let's pause there for a second. Again, really crucial, I think, to have these checkpoints. One of the things that I think frustrates patients, and understandably so, is they change their diet, they use supplements, and they're not sure, well, when should I be noticing something, and how do I know if I'm seeing the level of impact that I would want to see? So this is really where a 3 to 4 week trial, we should at least be seeing clear signs of improvement. Certainly not necessarily full resolution, but are you improving? Yes or no? That's a really important checkpoint. So yes, as she said, the fog was lifted. There was an improved bloating, feeling relaxed, a loss of weight. However, there was no responsiveness in her heavy periods and in her headache. So really happy with where we are thus far. And this is what I would remark with the patient. Obviously, this is a great response. And what can we do here to sort of tweak the recommendations further to get rid of the heavy periods and the headache? So let's see where they go next.
Herb called Vitex, which helps to offset that, helps raise progesterone, which can help with that heavy period. And then we also brought in some more protein into your diet, because I suspected you were on the lower side there. We had some nice protein shakes, which you now enjoy in coffee, which so do I. And then so at our next follow-up, basically, one thing that really stood out to me is that you only had one headache since your previous visit. So kind of just talk a little bit about that. I'd love to hear more about that.
Yeah. So I was a daily headache getter. It would be every morning, and then they would kind of, fizzle out through the day, or at night, it would just kind of come in waves. And it was always such a constant that it was a little further into the diet when my body finally kind of went on that autopilot for the head, to where it sounds really dramatic to say life-changing, but when you've gotten headaches since you were 9 and now you're 27 and you don't get them every day, you feel like a new person. So it was just really exciting. I don't know. It's one of those things, like, my goal starting this wasn't to get rid of my headaches, because I always thought that they were going to kind of be there forever, or they were kind of like the long haul part of being Emily is you're going to have a headache. So that was definitely just like a very incredible added plus to this whole situation that I didn't think was going to happen. So I can't really say anything but great things about how that one played out.
Yeah. And that's just one thing that I noticed. A lot of patients, everyone in general, when you experience something for so long, it just becomes a part of who you are, and you start to just tolerate having that symptom. But I definitely want to acknowledge or just encourage that people don't become, complacent with feeling a certain way, because usually it can change. Like the headaches, for example, you thought it was just kind of who you were, but clearly that's not who you were. And there was something, and, I didn't give you anti-inflammatory, supplements, or we really didn't target that. We just treated the gut and some of the hormonal components with just some gentle herbs, and that all just really cleared up so well. And that's just such an important thing to understand, is that you don't need, complex. I think you said this yesterday or whenever, 2 days ago, like, complex problems don't require complex treatment plans. The plan's very simple, but it was very targeted at, a particular system, meaning the gut and then the hormones. And so just kind of want to get.
This is a great point. I love the way that whoever said this first, whether it was Scott or Emily, I love the way that they phrased this, that complex problems don't require complex treatments. And I just want to underscore this, because one of the things that I've noticed repeatedly at the clinic is patients who have had symptoms for a while, and maybe they've seen a few doctors, and maybe they've done a few or several tests. They can fall into this belief that they're a complex case, and therefore they require complex solutions. And what's a travesty about this is oftentimes this leads someone to undergo all this new and speculative testing for the complex case, and not understand and appreciate that much of this new and complex testing isn't validated and doesn't really help us. And in fact, I would argue quite strongly that having a bunch of labs that are new and experimental and unclear as to how to treat them actually makes a complex patient's care worse. And part of this is because the psychological burden of all these tests are going to find all these things, a lot of which are BS, but they will still carry that psychological burden because the patient doesn't realize that this test may be not validated or suffer from a very high false positive or what have you. And it leads to more supplements. And oftentimes these complex cases can be a little bit more sensitive and reactive. Therefore, they have more reactions to the higher number of supplements, because more intervention leads to more of a likelihood for a negative reaction. And this furthers the feeling that they're a complex, challenging case. So it's really important that we don't feed into this and get stuck in this quicksand, and keep our bearings clinically and understand that oftentimes complex cases, they may even more so require a simplified approach so that we can diminish the noise and have a clear signal. And Emily's case is a good example of that, having had seen several providers, done lots of supplements. It wasn't a more complicated approach that helped her. It was actually a more targeted and simplified approach.
Your idea of, actually, before I ask my last question, we did repeat blood work and your testosterone was normal. Your DHEA was normal. And just that's, from what I understood, it's really never been normal for you. And so what's really funny is that the probiotics and then the inositol had been stopped for about 2 months. And when we had done the blood draw. So really it may have been the spearmint tea. It may have just been your, lifestyle change, but just anything you want to share about the lab change. And just to preface that, lab changes are definitely not everything. It's what I care more about is how you're feeling. So anything you want to share regarding your thoughts there?
And just as a quick aside, there are some evidence points showing that probiotics can help with PCOS, as is there for inositol, as there also is for spearmint tea. And there is evidence, at least mechanistically, tying the gut microbiome and those bacterium and their ability to help with detoxification of female hormones in balancing female hormones. So all these things probably coalesced together and led to Emily having this positive response with her, specifically here with her testosterone.
Yeah, because like I said, I went to a slew of doctors before this and I kind of lost hope because the labs were always funky and it would never be so off that it would raise so many red flags, but it was always off enough that I knew that it was off. And so to have normal ones for the first time was, again, incredibly exciting. And I think like you said too, and like what I've said, like giant problems don't have to have giant solutions. And I felt like I was just this one giant problem and I had all these things going on. So it was going to be a big giant solution. But realizing just like your body's domino effect and just like celebrate the small wins because it's going to continue to domino the opposite direction. I think that was the biggest for me, was that excitement of knowing that there are still few that could get better. Like my iron could get better, but it's still dominoing. So I just have to keep doing it and it'll continue to do better as long as I continue to give my body what it needs.
Yeah, absolutely. And also just talking briefly about the fact that
sorry, Scott, not to cut you off, but just checking in on iron, there are other data showing that probiotics can improve nutrient absorption and can improve iron levels, even if dietary iron intake does not change. And part of why she's probably iron deficient could be dietarily, sure, but also is very likely due to the fact that she has heavy periods. So as the heavy periods improve, she's losing less iron. As her gut health is improved, she's absorbing more iron. So all these things, again, really coalesce nicely and do have this sort of compounding effect or this upward spiral phenomena that we're really trying to reach with every patient.
I mean, you haven't, and this is a good thing, you haven't been strict with the diet, right? We wanted you, the goal is to expand your diet as much as possible. So after that first visit of the nutrition plan, we started talking about, all right, let's just start bringing in some foods and seeing how you feel. And so now what's your experience from a nutrition perspective, like in terms of, how you're not being restrictive, but that doesn't mean that you're just going crazy, but I guess, can you speak a little bit about the nutrition aspect of things currently?
Yeah. I definitely think that your body kind of tells you what it needs. And I didn't realize how much garbage I was putting into myself until I started with a clean slate. And then once I started adding foods back in that weren't garbage, but used to make me feel bad before, I wasn't getting those reactions. And then now when I do eat like the real not great junk food, which I'll never not eat. I mean, there's always going to be times where I'm going to enjoy it, but it doesn't give me the reaction that it used to, or I don't crave it as much. And it's definitely like, my body wants those good, real foods. And I think it's seeing the light at the end of the tunnel that there's some, all the good things out there to really kind of cling on to. And yeah, I think my body's doing a good job of letting me know what I need to put in it and what my body does not want inside of it.
Yep, that's great. And that's a fantastic point. Just your body is the boss. It'll tell you what is working for it and what is not working for it. Really, there's no test that can do that except, just kind of, listening to your body. So I think that's a fantastic skill. Like you learned throughout this journey that, what you eat affects how your periods are, and you learned how it affects your skin. And so that's just such an incredible lesson that a lot of people aren't aware of that fact, and they don't connect those two things.
Yes, this is another crucially important point. We often say at the clinic, your body is boss. And this ties in with a way of describing our clinical model, which is evidence-guided empiricism, meaning what therapies, what dietary changes, what lifestyle changes, what supplements have the requisite randomized control trial evidence showing that they're effective and guiding how to use them. So that's the evidence guided part. And guided because we don't want to say, I don't love the term evidence-based because sometimes it means, well, if there's not a randomized control trial, we're not going to use it. But there may not be a randomized control trial today, but there could be one 6 months from now, a year from now. We want to be careful, right? But if there is a real paucity of data, then we have to make our best inference. So if we're only going to be evidence-based, that can be limiting because it limits how we think and how we care for an individual based upon what's currently been published. So if we're evidence-guided, we're staying really close to the evidence, but we can venture out and make some safe inferences on occasion when there's a limitation in the data. So that's the evidence-guided part. And then empiricism really ties in with the body is boss in that empiricism, meaning we're running these experiments and listening to your body's symptomatic response to guide our care. And this, in many cases, not in all, is a very nice departure from the treating the labs paradigm that's fairly ubiquitous in healthcare. Now, sometimes treating the labs is really important, but there are so many labs that are new and they're inferential or speculative. And so when we treat a lab marker for which we are unclear on the value of said lab marker, we do the individual a huge disservice. So in the areas where the lab testing is not super definitive and does not have a high predictive value, we use the individual's symptoms to guide care. And that also connects into the concept of listening to your body regarding diet. There are so many patients who just based upon faith or fear will avoid certain foods because they've been told they have candida, or one test 3 years ago found candida, or they think they have SIBO, or they at one point had a positive SIBO test and they read about all the foods that you should not eat if you have candida or if you have SIBO, yet they actually feel quite well on those foods. It's really important to bear in mind that the outcome, how you feel, will summarize the litany of mechanisms impacted by a food. Maybe a food is a little bit pro-candida and pro-SIBO, but maybe it's also anti-inflammatory and pro-motility, and it gives you enough, let's say, carbohydrates to sleep better, and all these things lead to a net positive outcome, which is reflected by symptomatic improvement. So really important few concepts here to keep in mind also.
That's so important. And also by healing your gut, you can then expand your diet to things that you previously reacted to, like rice, I believe is what you mentioned.
Mm-hmm.
I had before, but now you can enjoy rice because now your gut is on the mend. It's much further along than it was before. So that is awesome. I'm so happy with how far you've come. And I was doing the math and it's only been 5 months since we started. So it's really just really, really awesome. And I'm just so happy with how you're doing. Is there anything else, any last things you'd like to share for anybody else that's maybe in a similar position as you were previously? Anything you want to share with them? And yeah, anything at all?
Yeah, I would definitely say you have to treat it like an investment and you have to invest in yourself because it's a long-term investment. And that was it for me, is I always thought about it as like a short-term investment of like, I would go to a doctor, they would give me something and it would be fixed and then I would go about it. And it's just like a one and done. But just to really commit to yourself and give yourself grace and give yourself patience and give yourself the time to like feel good and do it. I'm so excited. I invested this much into myself in my 20s so I can use that long-term investment when I'm 60. And now I know what to do and how to do it and how to feel good. So that's my biggest advice, is just invest in yourself because you only got one.
That's such a great, that's awesome. I love that. It's so important because you're right. When you're, there's so many people that have been in this position that when they don't do something, they end up with, unfortunately, going through surgeries and like removing their, uterus and it doesn't end well. But I'm so happy that's a beautiful, way to phrase that, and definitely gives a lot of women hope out there. So, ignore that dog barking in the background. Hear it. But awesome, Emily. Thank you so much for taking the time here, and really so happy with how well you're doing, and you will only keep getting better.
Thank you. Thank you so much.
Absolutely. Take care, Emily.
Okay. So I hope you learned a lot from that case study. It was a very nice, I suppose, reinforcement of the concepts that we try to embody at the clinic. And remember, if you are suffering with gut health issues, female hormone health issues, and you're looking for a second opinion or someone just to help you along your path, myself or anyone on our clinical team would be more than happy to help you along your way. This is really what we are passionate about. It's the core of what we do, is just being face-to-face with individuals and helping them navigate the landscape, because there's so much information out there. You have so many options regarding diet, supplements, testing, and how to use them. And it can very easily lead one into spending lots of money and potentially getting sucked into treatments and therapies that they don't need. So we really pride ourselves on trying to help you navigate this landscape as responsibly and expeditiously as possible. So feel free to reach out to our office anytime if you need help. And again, this is Dr. Michael Ruscio. I hope you enjoyed the conversation with Emily and Dr. Scott.